Can sudden loud noise cause permanent ear damage? Have you ever wondered if a sudden loud noise can lead to lasting damage to your ears? The answer is yes, it can. Sudden loud noises, like gunshots or explosions, can cause immediate harm to the structures of the ear. This damage can include rupturing the eardrum or affecting the tiny bones in the middle ear, which can lead to permanent noise-induced hearing loss. This type of hearing loss can happen instantly and is often irreversible. The main issue occurs in the inner ear, where sensory hair cells and auditory nerve cells resided within the cochlea. These hair cells are crucial for converting sound vibrations into electrical signals that our brain interprets as sound. When exposed to extremely loud sounds, these cells can be lost. Unfortunately, once they are gone, they do not regenerate naturally, resulting in permanent hearing impairment. Typically, noise levels that can cause permanent damage start around 85 decibels with prolonged exposure. However, sudden noises that reach much higher levels, like blasts at 170 decibels, can cause immediate and severe damage. Even just one loud blast can lead to significant loss of hair and nerve cells. Additionally, exposure to loud noises can lead to fluid buildup in the inner ear, which can further contribute to nerve cell damage and hearing loss. Some experimental treatments applied shortly after exposure to loud noise may help reduce this damage, but these treatments are still being researched and are not yet standard practice. It is also important to differentiate between temporary hearing loss and permanent damage. Temporary threshold shifts can occur after exposure to loud noise, where hearing may return to normal within hours to days. However, there can be underlying, hidden hearing loss, where nerve damage occurs without obvious changes in hearing tests, leading to long-term auditory difficulties. Interestingly, common recreational loud noises, like music concerts or using headphones, generally do not cause permanent nerve injury in young adults, according to recent studies. However, temporary changes in hearing may still happen, and the risk of permanent damage depends on how loud the noise is and how long you are exposed to it. In summary, sudden loud noises, especially those that are extremely loud, can cause immediate and permanent damage to the sensory cells and nerves in the ear. This can lead to irreversible hearing loss and conditions like tinnitus. To protect your hearing, it is essential to use hearing protection and avoid exposure to very loud sounds whenever possible. Always consult a healthcare professional if you have concerns about your hearing health.